Hi guys, today we're going to talk to you about a research article that I was reviewing. This one is super recent. It was published in 2023. This one talks about multimodal aspects of rehabilitation of concussion patients. So the important thing here is to realize that every practitioner that you see has their own subset of specialties, as well as their own training in terms of what things they learn, how they're going to apply them, or what kind of rehabilitation methods they're going to use to try to help you recover from your post-concussion syndrome. But this article as a whole, it looked at 64 people suffering from post-concussion syndrome, and typically after that 2-year mark. And one of the things that they found is, generally speaking, the patients do better when they have a more comprehensive therapeutic process in terms of helping them with different facets of their post-concussion syndrome symptoms. So things where they're looking at maybe the neurocognitive abilities, things where you're looking at the vestibular aspect of things, when you're looking at the visual component of head injuries. Now, the more of these kind of factors that you can kind of help push or stimulate or help the patient work on, the more likely they are to make improvements. One of the things that I always like to tell my patients, though, is be careful, because sometimes doing more isn't always better. One of the reasons I always say this is if you're doing too many things and then your brain starts to reach that fatigue point, well, then you're not really able to handle those therapies and you're kind of always depleted. So you have to kind of find a healthy balance between having different practitioners that might be doing multiple different things within themselves and that complement one another. You don't want to be seeing the same, like maybe 5 different people who are all just doing vestibular rehab on you. At that point, you need to kind of have different aspects that need to be pushed from different healthcare providers and maybe from different points of view as well. And that can sometimes be very beneficial to help you kind of continue with your recovery process. I hope you guys enjoyed the information today. If you did, don't forget to like and follow.